Hello and welcome to another beautiful episode of Softline. I'm Nancy Banigo and I have today with me Eddie Young. Hey Young. Eddie?
John, today with me. I'm always here with you on Mondays and Tuesdays. Nancy, let's all start our own. Hello everyone, how are you today? Don't mind us. Today is maybe for me, it's a trouble day for Nancy, but I won't give it to her.
No.
We are always excited to know that you're there watching us.
Absolutely.
How are you today?
Absolutely.
Softline is coming your way on IDBN TV, and remember to follow us on our social media handles. We will do justice today as usual. It's going to be soft, interesting, educative, and informative.
Perfect.
Stay there.
Perfect. Perfect. How you doing?
I'm fine.
So what's your take? What's your two kobo on the trending?
You still want to come up with that here? Are we changing our topic?
We have to. Let's talk a little bit about it.
So
I even
much
think we
to
should
talk about.
We should have a topic because there's so many lessons to draw from this incident on the what's her name again?
There's so many angles to look at it on that.
Emerson versus Ibom Air. There's so many lessons to take away from this whole saga. But let's have your two kobo first.
My two kobo might cost $1. It might not even be kobo but $1. But you see, there are so many angles to this. I don't even know which to take out from.
Okay, let me ask you. Let's go. Let me just the treatment. Let's leave what she did now. How do you feel with the way she was handled in this whole issue?
But you see, without her acting in a way that she could be handled the way she was handled, she wouldn't have been handled so. So first of all, it's her actions that caused the reaction. So that's where we start from. You know, simple instruction. I come on air and you're telling me face the camera and I'm not facing the camera and I'm told to step down set and I'm saying I would leave. What's that? So I don't know if you can relate.
Yeah.
So simple instruction.
But let's not forget, because I see so many people are not playing that part of the video. There's a new video where she posted, where she wanted to
asked
leave.
the air hostess. Now, what happened before then? Don't forget that she had already violated the rule. And then the pilot had given instruction that they've called the security people and shouldn't be allowed out until the security people come get her.
Okay.
And she, in her typical arrogant, egoistic, name it, let me not even violate my audience in the course of describing someone. You know, she decided, she thought she was playing smart by videoing the lady.
Okay.
And if you see she was smart enough not to respond to her, all she did was man the doorway. So she could also defend herself. She was acting on instructions.
Okay.
So at that point, well, yes, further investigations or actions could be taken. But first of all, she was acting on instructions. I guess I wasn't there, but I assume based on what was happening. So yes, the actions taken on her wasn't right. She wasn't right. So the whole thing, like I said, both parties were wrong. Ibom Air security people were wrong at the way they tried to take. And again, she resisted. If she didn't resist, it wouldn't have happened that way.
Okay.
I'm sure if she had respected herself, she was restrained from coming out. And by the time they told her to come out, maybe the security people had, she quietly and respectfully gone out. That wouldn't have happened.
Well, the truth is that no matter how we try to, paint this whole thing, the fact remains that Ibom Air should have done better. They should have acted professionally. Because when they asked her not to step down off the airplane and she insisted on coming down, they would have allowed her to come down. Yes. And now because she can't go home, they have their terminal where she has to pass through before she can leave the whole building. They would have accosted her there. I mean, there's this thing people have. Sometimes every other person has left the airplane. She could be faced with some kind of trauma, the situation there was not pleasant at all. They would have just acted professionally. So what I see in this whole thing was just two people acting like street people. Yeah. They just behaved like Ibom need to do better with their staff.
So for me,
seriously.
So for me, if you ask me, yes, that's true. But at the same time, we know, like I said, in the letter they gave out, the press release, they cited names of people who had violated and where are those people? The sanction.
So what would they do to them?
The sanction on comfort, that indefinite ban is what I don't like. And then there is also a viral letter of warrant. You see the mistakes, the errors in the system, that even the letter of warrant is dated October 11th, and the warrant, she's supposed to be arraigned in court October 6th, but the letter for arrest and, for the arraign is 11th, dated 11th October.
So misunderstanding in the dating.
So even, like I called out somewhere and said, what will the lawyers interpret this to be? What contempt of the law is this? So
there's so much.
There's so much that. And again, let's not also forget that at the spur of the moment, there are times you take actions and then on a second, we're all humans. We're not programmed to react in a particular way at a particular time. So at some instance, you could overreact or underreact. That's what some people would say, you should have been smarter. So people are quick to judge. But my own take is, let's be objective.
Okay. All right. And then advice to people is that there's this saying in the local parlance that if a lizard and a rat go swimming, if the body of the lizard dries up, will the body of the rat dry up? So you should know where you find yourself. Who is going to fight for you if anything happens? Who's going to speak for you? Who be your father? Say you will be. So you should just
who this girl be? And then through social media, they have docked out so many information. Let's not go there because
So as parents, there is nothing worse than seeing your child struggle with earache, sore throat, and sinus infection. But the good news is that many of these issues can be prevented or treated with the right care. So joining us today is Dr. Abasiofon Udo-Affah. He's an ENT specialist who is here to share his expertise and help us understand how to keep our kids healthy and happy. Doctor, you're welcome to the show.
Thank you very much for
having me. Welcome, Dr. Abasiofon.
Okay, so we are discussing ENT today, a very common problem with many households. When growing up, you either see a child putting something in the ear or swallowing something or having this constant running nose. Okay, so let's just start with you telling us some of those common ENT issues. Let's start from there.
Common ENT issues. Thank you very much for having me, first of all. First of all, largely ENT is not poorly we are sparse in terms of distribution among doctors.
Okay.
So it's even the diagnosis of this common complaints, as we say, you've noticed that even in the society it's poorly done. So I want to thank the services of ADBN for creating this segment as a form of health education and awareness for these conditions. So the common ENT issues that children face, and usually you notice it peaks mostly during school periods, and some of it we see during these holiday periods range from ear complaints, nose complaints, and aerodigestive complaints. A research done in 2015 and 2016, one done in Port Harcourt and one done in Lagos, found out that the commonest complaint among children are usually ear complaints. Now these ear complaints range from wax impaction, which we call cerumen oris, and then acute otitis media, which is inflammation of the middle ear and the middle ear mucosa, which the person will come down with ear pain. The child usually will tug on the ear or say, "Mommy, mommy," for the one that can speak, "My ear is paining me." Or if it's a child that cannot speak, newborn baby that is having that ear pain, she usually come down with complaints of just crying uncontrollably and having a high fever. And that's one point to note, that it's not all fever in children that is malaria. Sometimes the fever is hiding in the ear, sometimes the fever is hiding in the nose, and sometimes the fever is hiding in the throat, or the malaria, as it were. So another one will be hearing loss. I want to point out that some children, I'm also answering two questions at the same time. Some children that are stubborn may not be hearing you. You may just be calling them, they're not hearing actually. And that is because, as I'll discuss later in the show, there is no set out screening programs for hearing in our society or in our locality, even at the early stage of life, which I'll talk about with the course of time. So living ear, we're actually, the nose complaints usually is running nose, as you have said. Running nose, it can be clear watery running nose, or it can be thick. Usually when the color, for the first 3 days, the running nose will just be clear colored. But once it becomes thick and yellow, that is usually when the child starts having the high fever. Now, why is it different between the thick and the running nose? At the initial time, it's viral. So viral is self-limiting. It can run its course and go. But once it's bacterial, you have to treat it at that time. So usually viral, you don't have to treat it. You can just observe, take antihistamines, as we call them. The common drug with Piriton, which people like taking over the counter medications. They can help to dry up the nose from those secretions. And following closely to the running nose, which everybody knows, we call it rhinosinusitis, which you've called sinusitis. So we call it rhino, which is Latin for nose, and sinusitis, which is the cavities beside the nose. So they are just air-filled cavities beside the nose and in front of the face. So closely following it is foreign bodies. Children, out of curiosity, and particularly male children, just like stuffing things into their nose. From organic to inorganic, it could be seeds, it could be beads, it could be battery. The one that makes us want to rush to intervene is battery, because chemically the surface of the battery will quickly react to the surface of the nose because of the charges, positive and negative charges. So, but for the beans and the beads and the corn and whatever, and cotton bud and bread and eraser, there's actually nothing we have not removed from the nose. Some of those ones may just remain unnoticed unless by a very observant mom. So you note, as a rule of thumb, I always say, anytime I have a public forum like this, any catarrh in a child from one side of the nose that stays for too long, know the child has put something there. It's not catarrh. Once the catarrh is one-sided, it's likely, in a child, it's likely there's a foreign body there. But if a catarrh is one-sided in an elderly person, know that it's a cancer. And should be seen by ENT surgeon quickly.
So it's supposed to be flowing from the two nostrils.
If the nose wants to leak, it should leak two sides at once. Once it starts leaking one side,
how about blockage?
The same thing with blockage. Usually it starts with discharge, follows with blockage. That's how we follow the symptoms. Discharge usually starts first. Then if there's something growing there, it will block. Then after, if it's an elderly person and it's a cancer, you start seeing blood on that one side. So for the children, usually we would think first of foreign body before we think of any other thing.
Sorry, doctor, let me be quick to interrupt. How about nose bleeding when you talk about
so nose bleeding, still before I leave the nose, it's not a common complaint in children. Nose bleeding is commonly seen in middle age like us, or younger adults, or elderly. But when you see a child bleed, it's usually both nostrils. And most likely the problem is it's a systemic problem. It's not from the nose itself. Maybe the person is having, either it's a sickler, or is having a bleeding disorder, or maybe the child just decided to pick his nose, or somebody attempted to remove something from that child's nose. Children don't bleed like that. It's common among young adults and elderly. But if it's catarrh, which everybody feels is a normal thing, it's very common now. In fact, it peaks during the school period because it is shared very commonly among school children because they touch themselves. And this is an opportunity to also say the school should try to ensure hand washing. This will reduce the spread of this. Thank God for the advent of COVID, Ebola, and things that made us to wash our hands and cover our faces. But now, since the alertness has come down, everybody has thrown caution to the wind. And we have a respread of our nasal symptoms.
We're talking about that sinusitis. What's the difference between cold? You know, when somebody is down with cold and then the sinus. How can you differentiate?
Okay, I think I peeked into it a little, and just so for the stressing of the point. Okay, so when you say cold, common cold, it's usually a viral inflammation of the covering of the nose and the cavities around the nose. Now, the cavities around the nose, nature put them there for our voice resonance, for feedback, also help to lighten our head, and also gives a good surface area for oxygen to be absorbed. More surface area, like a carpet, from the nose to the sinuses for oxygen to be absorbed into the body. So when those cavities have holes that drain them, we call them ostia. They are holes, or ostia, Latin for mouth. Most words in medicine are Latin. So ostia or ostium are openings that drain each of these sinuses about. They are paired one, maxillary, ethmoid, and frontal. Then we have one behind the nose, the sphenoid. Now all of them drain into the middle of the nose and they come out as discharge. Now, usually we are having these catarrhs when we have a normal day-to-day. It helps, that catarrh is just a secretion that helps to make your nose to be wet, to be humid, make the air that comes in not to be dry, so that by the time the air gets into your chest, has water inside. It's like an air conditioning system, which nature puts in for us. And on a basal rate, there's still secretion going on, but it doesn't disturb us. But once there is an irritation, someone sweeps the ground and dust is in the air, or someone clears grass and those pollen is in the air, it now irritates that mucosa. So there's more secretion. And with that more secretion, they now notice that either anterior discharge in front of the nose or posterior behind the nose. Anterior is more common in children, but posterior is more in adults because we swallow it unconsciously. If you feel it's a sign of wealth or a sign of old age, so we do. Is someone who has kata and needs to sort it out. It's not that you are rich or that you are. It's just you need to sort it out, because that usually leads to other things. Okay. Let's not go into adults. So let's stay on children. So cold in children simply means a viral inflammation of the covering of the nose and sinuses, which cause excess secretion of transudates, which we call kata. So it's usually self-limiting, like I said, 3 to 4 days, fluid intake, paracetamol if the person has fever. Now, if it exceeds 5 days and then starts having a thick yellow color, that is when it becomes sinusitis. And then that person will now have fever, congestion on the face, will now have pain between the eyes, and for some, because of the sphenoid sinus, will have headache. So it is actually misdiagnosed as malaria. So commonly in the town, you hear, oh, I had catarrh and had fever, and I went and treated malaria. Whereas what you had was that a viral sinusitis moved into bacterial sinusitis, and your body now reacted by creating fever, body weakness, and the usual symptoms that overlap with malaria.
But when they are being treated, it clears.
Yes, it's something we call in science placebo effect. Now, the body notices that you have taken something.
Okay.
So sometimes even without taking something, it may clear.
Okay.
But just because you've taken something and it cleared, how do you know that what you took cleared it?
So because each time it comes, I'll just go treat myself because that is what worked. So
again, I'm not saying you're wrong, but what I'm saying is that there's something called placebo effect. It works sometimes. You can just treat one thing and the body reacts by, okay, well, since you're treating something else, let me just calm down. But it doesn't mean that you made the right diagnosis and you treated the right thing.
All right, let's talk about allergies.
Yes.
Because, growing up with children, I don't know. There's so much to be careful of. Allergies here, allergies there.
Yes.
So let's talk about how these allergies impact ENT in children.
Okay, allergies and ENT in children. So since we're still on the nose, we can move that discussion from the sinuses to the allergies. Okay. So in allergies, basically everyone has allergies. Let me start like that. Some people, nature may have given them the unfortunate version, which is called asthma. Okay. Now, so the reaction of the lungs and the lower airway is called asthma. But the upper airway, that's from the throat up to the nose. Okay. That one is the one called allergies. So sometimes they coexist. Someone that has allergies most times will have asthma. So there's something called unified airway treatment. So you treat if the ENTs and the chest physicians have looked for a way to tackle them both. So any reaction of the nose or the paranasal sinuses to a foreign substances usually could be dust, could be rugs, could be perfumes, could be anything in the environment. Could be claimed as allergies. These persons will come down with symptoms of nasal obstruction, nasal discharge, frequent bouts of sneezing more than 5 times in 1 minute. Frequent bouts, not the one sneezing, but frequent bouts of sneezing, nasal obstruction, nasal discharge is almost diagnostic for allergies. The person may have coexisting symptoms like itching of the nose, itching of the eyes, and itching of the ears. Yeah. Some of them will have something we call hawking sound. The person will go, or the person make one funny noise that makes everyone uncomfortable. It's your way of trying to use the back of your tongue to itch your throat. So that is why the specialty is called ear, nose, throat, because the coverings covers all those areas at the same time. So it's best you handle it as such. So allergies are common in children because of the following reasons: overcrowding in the environment. Now let's say we have a house of 10 people or 5 people, and the windows, first of all, there are more than the number in the house. Secondly, the windows are inappropriate. Thirdly, maybe the parents smoke. Now, all those cause defective ciliary activity. Now, what's a cilia? It's like small brushes on the covering of the nose that nature puts there to sweep away things that have been caught in the catarrh. So when those small brushes, they beat in unison towards making you unconsciously swallow those things that would have been allergens. Now, once that is defective by overload, overcrowding, poor activity by smoking, and depressed immunity in the child, which the immunity of the child is going to predispose the child to allergies. Now, the common symptoms, in addition to the itching of the nose, nasal obstruction, nasal discharge, itching of the ear, in children, it leads us to the aerodigestive, which was the commonest point, which is the adenoid.
Okay.
Now, the mucosa just behind the nose has a protective organ or lymphoid tissue called adenoids. Those adenoids are responsible for trapping allergens in the air.
Okay. All right.
Now, when they get inflamed by the nose reacting, and then it reaches it now swells. So when it swells, it blocks behind the nose. And since children are obligate nasal breathers, they will have to look for an alternative to breathe. So they have to keep their mouth open.
Okay.
So with the keeping of the mouth open, the child will come down with what? Snoring, noisy breathing, and mouth breathing. Now, when that adenoid becomes too enlarged and persists for a while, the child will now have intermittent sleep disturbances. So in between sleep, the child says let him close his mouth and he stops breathing. So you do that for over the night. So for every hour, the child is having intermittent cessation of breathing. The sleep will become inconsistent. The child will not grow properly. The child will not concentrate well in school. The child will be peeing at night. The child will be, I don't want to even go to the systemic one, because of that persistent carbon dioxide concentration in blood because of closing the mouth intermittently.
So what are
They
the
had to have to
fast walk more?
Yes, and then it will thicken the heart muscles and it can lead to heart failure. So the sequelae from adenoid is too much for a
Now
child
let's
to
talk
bear.
about the treatment option for these things you've just
For the allergies
Yes,
and-
For the
these
allergies?
Yes.
All right. So at the point where it's viral, most over-the-counter medications, which we commonly known as Piriton or chlorpheniramine, some chemists, some pharmacists write it, oh, I'm having catarrh. So they give you one drug. Many people don't know the names.
Okay.
And they give the drug. The drug will make you drowsy, but it will dry up your nose. So there's a syrup form of it. So most parents will just give. And if it's viral, it's allergy, and maybe whatever triggered that child's catarrh was within the environment, it will stop. Now, how does it stop this reaction? It stops it by switching off the body's response to this allergy. It's not that the allergy is not still in the environment, it's still there. The body's response has been switched off if it was the environment. If it was viral, it will give the body time to acclimatize while the virus runs its course and goes. Because as we know in medicine, virus has no cure. So most what is causing those allergies may just be adenovirus, echinovirus, Epstein-Barr virus, and those viruses just have their time. Even the common one that made all of us sit at home, coronavirus. Those things had always been there. It's just that version of it, COVID-19, made everybody aware that coronavirus, but it had always been there and it always caused catarrh. And we were just living with it. But suddenly a particular strain made everybody sit at home. So virtually most of the allergies we have are viral in origin and they are self-limiting. Just like chicken pox, let me just go the one that everybody knows, chicken pox. So every virus don't have a cure. When you get infected with virus, the body just has a response and it curbs the virus. When you're eating well, you are well
Your
fed.
immune system is high.
The virus can be with you, you don't know. It doesn't give you a problem. But when bacteria super infects the virus after it has irritated the mucosa, and that is when you now see the change in color, the fever, the weakness, the every other thing. And then for children, that's this we're talking about children, we now have that snoring, mouth breathing, and stuff. Now the problem we have, sorry, I'm putting it into deep waters, is that since behind the nose gets inflamed and is closely related to the opening that leads to the ear, the child may also complain of ear pain while he's snoring. For some children, if it's poorly handled, With that ear pain persist for a while, it may even break. The eardrum will break out of the bacteria, the pus just loading inside it, and it will be break, and then the child will now be having
Pus
that
running
pus
down.
running from
All right,
the
doctor.
ear.
All right, thanks for being there. So we have the doctor in the house talking about ear, nose, and throat in children, common issues that affect those areas in children. And I tell you, this doctor has been doing justice to this topic. But let's see one tweet. We just have only one tweet here from First Doctor. And it says, children of parents who smoke are at risk of having a condition known as glue ear or otitis.
Otitis media.
Otitis media. Okay.
Otitis media.
Okay, with effusion,
yes.
which can lead to hearing loss. Yes. If you are a parent, please don't turn your kids into second-hand smokers. Yes. That's the only one we have yet. Yes. Doctor, could you please talk on that?
Otitis media with effusion.
Otitis media.
Okay, otitis media with effusion. So I touched on it a little before we went on the break.
Okay.
So otitis is Latin for inflammation of the ear. So otic is ear.
Okay.
Otitis is inflammation. So otitis media, middle ear. Now the middle ear is simply ranging from the eardrum down to the border of the inner ear.
Okay.
That area called the middle ear drains into a place we call the auditory tube or the eustachian tube, which opens behind your nose. Now you see the link between nose and ear. So for it to regulate, it has three functions. In basal function, it helps to make sure the pressure equalizes in your ear, which we notice if we have a cold and we enter a flight. We notice that when the plane is ascending, you suddenly feel
very
that
heavy,
pressure.
like
so
it's blocked or something.
It blocks, yes. So what happens is that these are muscles which must open and close with change in atmospheric pressure. So you have to keep swallowing. So that sweet they share on plane is not out of luxury. Or that gum they share in plane is not. It's to help your eustachian tube to open and open and open to regulate pressure.
Really?
Now, that is the pressure regulation aspect. The drainage aspect is, since your middle ear is lined by a particular thing we call mucosa, which is lined by a particular carpet or mucosa, it secretes a little fluid every hour.
Okay.
Now that fluid has to be momentarily drained from the middle ear.
Okay.
You understand? So once that auditory tube or eustachian tube is inflamed and narrowed because of cold or catarrh.
Okay.
Because let me use the word proximal.
No, we're talking about smoke now.
Yes, I'm still coming there. Sorry, I'm starting from the first principle. Now, so if that tube is blocked because of inflammation of the nose and by extension, the medial aspect of the eustachian tube, which is on the sides of the nose, on the sides of behind the nose. So there's an opening. It's called the eustachian tube. I don't know if the picture is shown. Yes. Now, so if it's blocked, it now causes a gradual filling or production of fluid in the ear. That fluid is a transudate. And that transudate is it's usually sterile. But the problem with it is that once it starts filling up that middle ear, when we look at that ear, we usually see bubbles behind the eardrum. Once you look at it with an otoscope, we see bubbles behind the eardrum. Now, because there's fluid in that ear, hearing will be impaired in that ear. Because the middle ear doesn't want water to be there. It only wants air. So once water enters, its function of hearing will be reduced. And that function of hearing reduced, the child will now tug his ear. And that's in that state of clear fluid filling of the middle ear is when we call otitis media. With effusion. Usually at that point, it is painless. It's painless. And if we see it on time, I'm going to jump to one of your questions. If we see it on time, we insert a tube, a grommet. It's just a small thin tube that we consciously puncture the eardrum and insert that tube there. So that as that fluid is gathering, it will go out. As that fluid is gathering, it will go out. It's replacing the function of the auditory tube that may have been blocked by the nose producing catarrh. You understand? So while we keep the tube there to drain that fluid, that glue ear, we now place the patient on drugs that will treat the nose, the allergies. And once the nose is sorted out, that tube will open up and we'll have to remove the other tube. You understand? So it's like a secondary, or that's where the tube comes in and the hearing will improve. The aim is that if you don't handle otitis media with effusion at that stage, it now moves to acute otitis media.
Okay.
Now, acute otitis media is when that fluid stays for a while. Nature doesn't like vacuum. So that the small bacteria that has been in that fluid will now start multiplying. And that fluid will not be clear again, it will now become cloudy.
Okay.
It's at that point the child starts having pain. Or the adult will start having pain in the ear. And the pain will be so excruciating that if you look at the eardrum, it is red. The rim will be red, the middle will be yellow, and the person will be in real pain. If it's an adult. But if it's a child, it can even convulse. It can just fit. And the only thing that would have made you sort it out, well, just look at that ear inside. And then maybe if an ENT person or a well-trained ENT nurse, you just use a needle, puncture it, consciously puncture it, and allow that fluid to come out, and the hearing comes back.
All right, Eddie, you were saying
Yes, quickly say
Tonsillitis.
no, before we get to
Okay.
care of the nose and
Okay.
ear.
Okay.
So the do's and don'ts.
The do's and the
So,
don'ts.
yeah.
I thought you wanted to talk about the
tonsillitis.
No, when we get to the throat, so
Okay.
let's just finish with
All
the
right,
sector.
all right, okay.
Yeah.
Okay, so quickly about the care. So first point I want everybody to know here is that please, your ear cleans itself naturally. Your ear cleans itself naturally. Now, this happens when you chew, when you speak, and when you chew and when you speak. When you chew, what happens is that this joint is just under where you have the canal that leads to this place. So for every time you chew and you speak like this, the small debris of wax, which is a natural, what I call it, nature. I don't want to use the word lubricant. What do you aim to achieve when you rub oil on your face?
to moisturize.
That is what wax does. Nature puts oil on the canal so that it will keep that place moisturized, keep it at a certain pH so that bacteria will not live inside there. And it also helps the place to be shiny and functional. Now, wax is not bad in itself because it contains oil, it contains sebum, it contains antibacterial properties. It also contains antiviral properties, contains some water, and contains some strand of your skin that may have.
So we should not be taking them off.
Leave it alone.
But it dries
Nature-
up at some point and
Now,
gets flaky.
I was still coming about
Okay.
how nature makes you clean it. So when you
Okay.
chew and when you talk, that skin over that place migrates outwardly. For every time, okay, good picture. For every time you chew and talk, the skin lining the canal migrates outwardly. And you will see that whatever that skin carried on your pillow when you wake up.
Oh, really?
Yes, if you observe your pillow,
If you are observant.
if you observe, you notice there'll be some small speckles of wax for every morning you wake up. Nature has sorted that out.
Oh.
Yes. Now that is one mechanism. Second mechanism is like what you have with the escalator. So this staircase that moves. Yeah. So we have the skin of the canal is like that. It moves outwardly every day
Wow.
from the eardrum to this lobe that we see here. So if you don't disturb wax migrates on its own and falls out.
Oh, really?
Yes. Now, what you have with wax infection is that you now take your cotton bud, which it is labeled there, do not insert into the canal, just like every cigarette pack.
Do not.
And then you now pick it and put in that ear canal. What you do is that you take distilled wax back
it
into
back
the
into-
ear
oh.
and bring out some. So that stale wax now is a good medium for fungus. You know that thing that happens on stale bread? It now grows on that wax and starts itching you. With over time, it will now start leading to what we call the swimmer's ear. Those itching ear that people that swim because of too much of the hair. But they call it swimmer's ear, but basically it happens to anybody who habitually uses cotton buds to clean the ear. So do not clean your ear.
Okay.
Doctor,
So
it's
that's
difficult.
for the
Yeah.
Now for the
So the
nose.
nose,
How do you
yeah,
care
how
for
do
the
you
nose?
care?
How do you care for the nose? Well, the beautiful thing about the nose is that nature has sorted that one out by giving our nose hairs. So the hairs filters the catarrh traps the germs, traps the viruses. So basically, those people that go around using shaver or something to shave the hair in their nose, I don't know whether you are wiser than nature that put hair in your nose. So the hair in your nose, you actually should not. There's actually not much you need to do about the care for
Not
the nose.
even soap and water, not cotton bud.
really?
Yeah, like
Soap and water.
Just
Yeah,
leave
just
your the beautiful thing about some ENT things, just leave them alone. Once you start trying to intervene in the nose or the ear, you are the one going to cause the problem. Those places, nature made them like that to be on their own.
So let's talk about the truth
The
now.
truth. Okay. So
Quickly
let's
before
still on children. The commonest complaint
Yeah.
with children, the truth is tonsillitis. Now, what is tonsillitis? It's an inflammation of the tonsil and tonsillar parenchyma. Now, what is the function of the tonsil? Tonsil, just like the adenoids, which everybody knows, they help in trapping germs from air and from food. And they also, in turn, help the child's immunity, so that in the long run, this child will be, the immunity of the body, the B and T lymphocytes will grow, and so that on second exposure, as the child is growing, it can withstand those infections from the airway. Now, there's a theory that states that children who may have not been grown up in houses where they are very, we call them the germ theory. Like children who grew up in a house that the hygiene is not too meticulous tend to have less of this tonsillitis than those that live in towns and are from rich families. Because the early exposure to the germs makes those tonsils and adenoids get used to the germs, and then they are ready for it. But those are in protected environment, protected families, clean families, they are mopping everything, they come down. But that's a theory. That those so we find out that those are more common with children from very affluent homes. They really come down with it. But you see the ones from not too affluent homes, they rarely come down with these things. Because they may just come down with sore throat, and it will not stay for some days, but it will stay for some days, then it will go. But when this, what are the common symptoms of this tonsillitis? So the patients will complain of sore throat, pain on swallowing, swelling on the neck, and sometimes fever, very high fever. Again, to tell you that some malaria that we are treating is tonsillitis. Some malaria we are treating is acute otitis media. And some malaria we are treating is common cold. So you can only make the difference if a doctor looks into the mouth, looks into the nose, or looks into the ear.
But the looking into the mouth is a problem because of that stick they insert there. I know that's a problem.
The mouth, you mean?
There's a stick they use for bringing down.
We call it a spatula. Yes,
spatula.
or a tongue depressor. Yeah. Well, the stick is a problem, and if it's well done, it's not a problem. It takes some level of observation of the basic principles of so just open the mouth, and put it on the tongue. And
we have very limited time, and I know we have a lot of questions to talk about. No, you should not be sorry. At what point should the parents say, okay, this is urgent, my child needs an ENT specialist? At what point?
I think we might well with that. Yes, thank you very much. At what point should an ENT specialist come in for a child? Okay, so if a child is snoring so much and there's an observed apnea, we call it cessation of breathing while sleeping. Snoring and observed apnea. Of up to that cessation of breathing while sleeping, that child needs to see an ENT so that we evaluate if it's an adenoid, we surgically remove. The procedure is called an adenoidectomy. It's fairly safe, and it doesn't even take up to 30 minutes. It's fairly safe. And we don't need to incise anything. We just put an instrument in the mouth, keep the mouth open, child is put to sleep, and we remove it. Same goes with tonsil. If the child keeps having sore throat up to 3 episodes in 1 year, maybe he has treated with antibiotics, it comes back again. You've treated with antibiotics, it comes back again. If it's up to 3 episodes, please, there's no need of treating again with antibiotics. Let's remove it. That's an indication for surgical removal of that tonsil. So I've said for the adenoids, the reason to remove the adenoids, if this child is having this cessation of breathing while sleeping, it might impair the child's growth, might predispose the child to heart failure, might predispose the child to poor brain development and the like. So you need to see an ENT surgeon for that. For the tonsil recurrence of this sore throat, you need to see an ENT surgeon. If a child, while playing, suddenly has difficulty in breathing, know that he has aspirated a foreign body. The child is just playing. Suddenly, he has put something in the airway. Should run and come to the hospital. Or a child, while playing, suddenly says, "Mommy, I'm having pain on swallowing. I'm having difficulty swallowing." Or he cannot even swallow his saliva. For a child that will not talk, the saliva is just coming out, drooling of saliva. He probably has swallowed a foreign body. We've removed pen covers. We've removed in the throat. We've removed the razors. We've removed covers of Coke. Coke caps inside. We've removed the batteries. We've removed. There's hardly anything we've not removed. there's LED lights. Thank God there's no coins again in Nigeria. My teachers always say in those days it was always
coins.
they were coming with coins. In fact, every night you just know that at least 2 coins will come during the holiday. They tried this holiday.
Oh my goodness.
The coins will keep coming and stuff like that. So sudden difficulty in swallowing while a child is playing, or sudden difficulty in breathing, or noisy breathing while a child is playing, is foreign body until proven otherwise. Sudden or unexplained one-sided nasal discharge in a child is foreign body until proven otherwise. Bleeding, sudden torrential bleeding from the nose in a child is likely it needs an ENT surgeon urgently. A child pulling on the ear and saying, "Mommy, my ear," or crying uncontrollably, or ear discharge that has not gone. Maybe the ear discharge, he had ear discharge, the place on antibiotics is not going. He needs to see us so that we'll sort out why is that ear still discharging. Because if you don't sort out that ear discharge, there are complications.
Okay.
The closest relation to the ear is what? The brain. Upward.
Absolutely.
So if that pus remains in that ear, it will migrate or it will erode the roof of the brain and go into the brain and then cause meningitis, abscess, and we know the stools.
Okay.
Right.
Okay. So, doctor, I'm also curious to know if a child puts some cotton bud, or maybe in the course of cleaning the ear, the cotton falls
inside the ear.
Can you ignore that, or it needs ENT intervention?
Did the mother notice it?
Sometimes,
all right.
Yeah.
Well, it will need an ENT intervention. You just need to look at it and remove it.
So the wax won't swallow it up.
This just reminds me of what happened to my daughter once upon a time. She just came into my room and she told me something was working inside the ear. I was like, it's nothing, just go and sleep in the night. She slept and she would start crying. There's something working. I took the phone, I checked, I didn't see anything. But we didn't sleep that night until I just thought of something. I just take what they call it,
olive
castor oil, and then I poured inside. And it took a whole struggle to be able to put that in. But when I finally put that oil inside, within 2 minutes, a very big ant coming out of her ear. I was like, oh my God. And I didn't believe there was something actually going on in the ear.
That is because you were enlightened. And it's good you mentioned it. And it's a correct thing. If you feel an insect is in your ear, the first aid is put an oil. Any oil.
Any oil.
Olive oil.
Palm
Whatever oil. You suffocate the insect.
Palm oil.
Yes.
Inclusive.
Olive oil, palm oil, whatever oil. The aim is to suffocate that insect. It will slide out.
Do you have a way of making it warm or at any temperature?
I just poured it inside. I didn't want
because some people would say make it warm.
Some advocate the warmness. Now the warmness has a science behind it. Now if you put a very cold oil in the ear, the eye may turn. We call it Joe's effect. So it should be at least body temperature, not too cold, not too hot, just enough to.
All right. So finally, before we round up this, some parents have issues with speech in their children. So at what point should a parent be concerned about delayed speech in their child?
All right. So if a child lies down and sleeps very well when the generator is beside him, that's a problem. Yes. A child sleeping unperturbed in the midst of loud noise is a red flag. Yes, and a child that has to be frequently or repeatedly called, even at a close proximity, is a red flag. A child whose speech is delaying beyond, let's say 2 years of age, let me know it's 2 years of age before some parents become pressured. If the colleagues or the people that were born at the same time, they were talking, just give your child 1 more year. Everybody is not the same. Yes. If that child is having delayed speech, then it needs intervention. Now, this will take me back to what I was trying to say, that every child, I'm hoping government will advocate that every child as newborns will have hearing screening. We may pick some hearing loss or some stubbornness early. Because it may just be, you have to hear first before you speak. In fact, the first thing in ENT is that the first thing you gain as you're in the womb is that you hear your mother's voice first, even in the womb. That's why the baby moves when he hears the mother speak. And when he comes out, he hears. But once the child is not hearing, he will never speak. You have to hear first before you speak. Once you are not hearing, you cannot speak. And then, unfortunately, I want to quickly borrow my colleagues in the O&G. When a woman is delivering, all these people that are against CS and whatever, if you labor for more than a certain time, the result of that prolonged labor, apart from affecting the child's brain, will affect the hearing. So it's not just the fact that the child comes out and is yellow and they have to admit for 1 week. That yellowness, as it affects the brain, and you notice children come down and become cerebral palsy patients, they will also have hearing impairment because of that yellowness, which is toxic to the brain and toxic to the nerve that supplies hearing.
Okay.
So prolonged labor is not good.
Okay.
Antenatal that has not been attended, or a mother that has rashes or takes drugs that she doesn't know during pregnancy, that can cause problem with development of the ear. And once there's ear impairment, you cannot speak. So hearing screening at birth is important.
Okay.
And immunization of mothers and children from these things, like they call them diphtheria, pertussis, and tetanus, all those vaccines they give, they all have their place in making sure that the child hears. Then this early use of drugs that we're trying to discourage, prolonged prescription of drugs like gentamicin, chloroquine, or quinine. Those drugs they are good in themselves, but the problem is that they have a very bad effect on the ear. And if using them, injection or swallowing them, there's a reason why NAFDAC actually kept those drugs as second line, because they are, call them ototoxic. They are ototoxic medication. So when you keep taking those drugs for prolonged duration a long time, your hearing can be impaired. And once hearing is impaired,
speech definitely impaired.
You cannot speak.
Thank you so much, Doctor, for coming on the show today.
Welcome.
All right, so we're going to close with you giving us a closing remark. So as a doctor, talk to parents out there. Just 1 minute.
Okay, 1 minute. 1 minute. 1 minute to be. All right.
Let's make it too much.
Okay,
it will be too much.
Will be too less. Will be too much. Okay, let me just start speaking by this. I want to thank everybody out there, and I want to say that parents. I want to commend the mothers first of all. I always use time to commend the mothers. They're the ones that actually observe these things. Fathers are very busy, except of course those ones that work from home.
Some fathers
are very busy, because they're the ones that notice that child is not hearing. They notice the child is not speaking. They're the ones that notice that child is suddenly having difficulty in breathing, and they quickly come. So for our ENT, most of our procedures, please try and see an ENT person. We don't want people. The problem we face most likely is that let's say if a child puts a bead in the nose, problem we face most time, or the ear, is that someone has tried to remove it with the wrong instrument. And by the time the patient comes to the hospital, some of them we have to just take them to theater and make the child sleep so that we remove it properly. Because in ENT it says after 3 tries, don't try again. So sometimes we may even have to cut the ear, or we may have to use another approach to get that foreign body out. So if you don't have the right instrument in your facility, please don't attempt removing anything from the ear, the nose, or the throat, because by the time you come to the hospital, we'll be the bad guys, because we mentioned we have to. We are the bad people.
Don't even go there. Thank you so much, Doctor. Thank you so much.
You're welcome.
And that's all we have for you today, Eddie.
Thank you very much.
Doctor, thank you for the education. I tell you, you're never wrong on ADD, and you would agree with me today that it's
absolutely
very, very informative.
Absolutely. All right, that's all for today. We'll see you again tomorrow. Have a nice day. Bye-bye.